Does milk thistle benefit your liver? Milk thistle, a distinctive plant characterized by its spiny leaves and purplish-pink flower, has been recognized for centuries as a natural remedy for liver and gallbladder health. Despite sometimes being dismissed as a weed, this herb holds a significant place in traditional and modern herbal medicine. But what exactly makes milk thistle beneficial, and how does it support liver function? Understanding milk thistle. The name milk thistle derives from the milky white sap that appears when its green leaves are crushed. Also known as Mary thistle or holy thistle, this plant is native to the Mediterranean region of Europe but now grows worldwide, including in parts of Africa, Australia, and the Americas. A critical component of milk thistle is silymarin, a potent extract derived from the seeds of the plant. While the terms milk thistle and silymarin are often used interchangeably, silymarin specifically refers to the active compound responsible for many of the herb's therapeutic effects. The benefits of milk thistle for the liver. Silymarin is widely studied for its antioxidant and anti-inflammatory properties, making it one of the most popular herbal supplements in the United States for liver health. It is believed to help protect liver cells from toxins, support the regeneration of damaged liver tissue, and reduce inflammation, all of which contribute to improved liver function. Given the liver's essential role in detoxification and metabolism, maintaining its health is critical, and milk thistle offers a natural approach supported by both historical use and emerging scientific evidence. What can milk thistle do for the liver? Silymarin, the active compound in milk thistle, is believed to protect liver cells by preventing toxins from binding to them. Additionally, it acts as an antioxidant by neutralizing free radicals, unstable molecules produced during normal metabolic processes that can damage healthy cells and contribute to various health problems. Scientific research on the effects of milk thistle for liver health has produced mixed findings. Some studies suggest that silymarin may reduce inflammation and promote the repair of liver cells. These properties could potentially alleviate symptoms associated with liver conditions such as jaundice, cirrhosis, liver cancer, and non-alcoholic fatty liver disease. However, evidence regarding milk thistle's effectiveness against viral liver diseases, specifically hepatitis C, remains inconclusive. A significant clinical trial demonstrated that even higher than standard doses of silymarin did not result in improvements in viral load or quality of life for individuals with hepatitis C when compared to placebo. At present, no herbal supplement, including milk thistle, has been conclusively proven to treat hepatitis C. Nevertheless, milk thistle's antioxidant and anti-inflammatory benefits may support overall liver health in other contexts. Milk thistle's role in treating mushroom poisoning. While further research is needed to fully understand milk thistle's range of benefits, silymarin has demonstrated a notable track record in treating poisoning caused by the deadly mushroom Amanita phalloides, commonly known as the death cap. This mushroom is responsible for the majority of fatal mushroom poisonings worldwide due to its severe liver toxicity, which can lead to liver damage and even liver failure. Clinical studies indicate that silymarin can help neutralize the toxins produced by Amanita phalloides, offering a potentially life-saving therapeutic option in these cases. Potential side effects of milk thistle. Milk thistle is generally considered safe when taken at recommended doses. However, some individuals may experience mild side effects such as nausea, gas, diarrhea, or decreased appetite. Less commonly, headaches or skin irritation have been reported. Allergic reactions are possible, particularly in people sensitive to plants in the Asteraceae family, which includes ragweed, daisies, marigolds, and chrysanthemums. Individuals with diabetes should consult their healthcare provider before using milk thistle, as it may influence blood sugar levels. Milk thistle is not recommended for those with hormone-sensitive conditions such as breast, uterine, or ovarian cancer, endometriosis, or uterine fibroids, due to its estrogen-like effects. Pregnant or breastfeeding women should also seek medical advice before using milk thistle or any herbal supplements. Are there known drug interactions with milk thistle? Before incorporating milk thistle into your health regimen, it is essential to consult your healthcare provider. Milk thistle can potentially interact with certain medications, altering their effectiveness. Notable examples include diabetes medications, hepatitis C treatments, metronidazole, an antibiotic, diazepam, Valium, warfarin, Coumadin, Jantavan, sirolimus, an immunosuppressant. Your doctor can provide guidance on whether milk thistle is safe to use alongside your current medications. How should you take milk thistle? Milk thistle is available in various forms, including powders, capsules, pills, and liquid extracts. The powder can be brewed into tea, blended into smoothies, or mixed with water. Capsules and pills should be swallowed with a glass of water, while liquid extracts can be added to water or tea for consumption. Always seek professional medical advice before starting any herbal supplements, ensuring safe and effective use tailored to your health needs. For more reliable health information, stay connected with HeInfo, your trusted source for health education.